Hello, my name is Dr. Catherine Lowe. I'm an ophthalmologist, a medical eye care specialist. I practice here in West Palm Beach, the greater West Palm Beach area, Palm Beach Gardens. I'm also a member of the T. Leroy Jefferson Medical Society. I've been with the organization for some time. I'm presently the treasurer of the organization. The T. Leroy Jefferson Medical Society is an organization of very dedicated healthcare professionals and physicians who are really dedicated to providing healthcare services, lectures, mentoring, and education to all of the people in this community, and most especially to the needy and those who are underserved in healthcare. I'm from Palm Beach County. I was born and raised out in Belglade, so I'm a homegrown girl, and you can do. My folks were middle-class folks and blue-collar workers, so when you study hard and get the right skills and really make a commitment. I went to school, college at the University of Florida in Gainesville, and I went to medical school at the University of Minnesota. I also did my internship at Howard University in Washington, D.C., and after my residency in ophthalmology, I came back to Palm Beach County and basically came back to home to practice. I felt I was going to practice in Tampa, and a lot of people here in West Palm Beach said, "You're from here, and we really need you here because there's so many people who need your services." And I think that ophthalmology is a very important specialty. Eyes are really important, and people don't think a whole lot about that little small organ until you're having problems with the eyes. So we found that for glasses, diabetes, high blood pressure, all of those things, we see so much dry eyes, contact lenses, cataracts, especially glaucoma and diabetic retinopathy, with people having poor pressure in their eyes and losing their eyesight without symptoms. Glaucoma is an extremely important disease entity that can be prevented when caught early. Right now I have been here many years. My family is from here. I have lots of family here. My husband is in real estate and in business, and I have one daughter who's 22 and in college. And we have found that it's really important to give back to our community. So we are very much into mentoring and giving back. I also have very much a passion for the arts, and I have been very involved with the Palm Beach County Cultural Council and Artist Showcase of the Palm Beaches at the historic Jenkins House. I think it really is important for people to be good citizens and to provide for their family as well as to give back to their community. I believe I chose to go into ophthalmology because for me it was the right specialty. It was the right amount of medicine and the right amount of surgery. When I do surgery, I get to sit down. When I'm doing muscle surgery on children, if I do laser surgery or cataract surgery, I can sit and do my surgery. And also, it's overall a happy specialty. I get to see all ages. I get to see young and old. I get to see males and females. And it is very much a very rewarding specialty. When you give people their eyesight back, then we're very pleased to make that happen. I would say the biggest challenges that we see in medicine now is basically access. I think we have the best healthcare system in the world. And that's my bias, but I believe we do. But I think our biggest problem and challenge is for everyone to have access to that health care. And I think we're probably a little too disease-oriented, and we should be more involved with prevention. For me, when I think back on my medical education, I think my biggest challenge was being a female in a specialty that was really very much male-oriented. It is very challenging, and I think the surgical part of studying in medicine can be very challenging for a female. But here I am. I can say I was successful. I went through all of the challenges and was able to overcome those. And I had an advisor who told me, "I expect the best of you. I know that you are capable and you are able, so just go out there and do what you have to do. Get your lessons, study, and do well." if you're choosing a career in the medical field, any of the healthcare professions, I really say that I think you have to have a plan, you must have preparation, you must have purpose, and you must have passion. So I think it's very important that young people study, get good study skills, learn to manage their time, set themselves some goals, and be determined that they can accomplish those goals, be persistent, work at it, get the advice that they need from those who will say that they can do, and buckle down, be disciplined, and do their work. You have to have purpose, and it also almost to a spiritual point, because God has for all of us a purpose for all of his children on this earth. So when you tie into that purpose, then you will have your plan and your passion, and you will get it done. Go for it.